My name is Kelly Batley.
My name is Clay Thompson.
My name is Neil Mowney.
We are MRHFM, a national firm with 70 attorneys and 11 offices across the U.S.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
At Bristol Myers Squibb, we believe that a single touch has the power to transform, to help make every day better, fuller, happier, healthier. So we are always working, proving that innovation and compassion work best hand in hand, developing clinical trials that better reflect the communities we serve, ensuring that every breakthrough reaches those who count on them the most, striving to change the world, starting with a single life. Yours.
At Novacure, we strive to extend survival in some of the most aggressive forms of cancer through the development and commercialization of our innovative therapy called Tumor Treating Fields. Novacure is pleased to partner again with the Meso Foundation.
Hi, everybody. Thanks for joining us today. We are doing an episode of Survivor Stories, and with us we have Cristobal, who is a mesothelioma survivor, and he's here today to tell us his story. Cristobal, I'll have you start by giving us a little bit of background on how you sort of led to your diagnosis of mesothelioma.
Sure. Well, hi, Shannon. Thanks for having me on. It's been the Meso Foundation has been wonderful for me throughout my illness. So I love being able to speak with you and to all the viewers. So I've actually known about mesothelioma for quite a long time. My mom was diagnosed with pleural mesothelioma in the mid-90s. And, there's a time before there were many sophisticated treatments that there are today. She enrolled in a clinical trial at the time, which was, I think, a combination of Taxol and the platinum chemotherapies. Unfortunately, she passed away quite quickly. So I'd been sort of in the background, known about, like I said, known about meso, known about the illness for a long time, but hadn't really been thinking too much of it. And then, until I had to think about it. And in 2019, I had just moved from the East Coast to Southern California for a job. And one day, I just woke up feeling just sort of soreness in my belly. It wasn't super alarming at the time. It was just felt like I had, either done way too many sit-ups the day before, or I had laughed so hard, kind of like stomach cramps in the muscles. So, the only reason that stuck in my mind is because I hadn't laughed that much the previous day or done any sit-ups. And then this was on a Friday actually, and over the period of that day, it got a little bit worse. On Saturday, I started feeling really poorly. It was hard to stand up straight, get out of bed. And then Sunday, again, really feeling rough. And so I had a talk with my wife and I said, well, I'll go see a doctor. Fortunately for me, I think, 5 years ago, I would have just tried to suck it up for a long time. But because we had just moved and because I had just seen and got new doctors, I was like, I might as well go see them. So in fact, I ended up not going on the Monday because it was Veterans Day. And I thought, there's probably, the clinic will be busy or there'll be fewer people on call. So I waited until Tuesday morning. I was starting to feel a little bit better, but I, figured I'd go anyway. And so Tuesday morning, I saw a doctor, couldn't we couldn't think of any reason why my stomach would hurt so much. And so she said, you can go get an X-ray and an ultrasound. So this was probably at 11 in the morning, and she said, do a rush X-ray because it could have been bowel obstruction. So I went in for the X-ray around noon or 1 in the afternoon, directly after the appointment. My doctor called a couple of hours later, said, well, we don't see anything. You can cancel the ultrasound if you'd like. But you could still go. And I decided to go anyway. And so probably around 5:30 that evening, I had an ultrasound. Was in there for a long time. They're doing a lot of clickings of the mouse and, measuring things. And about an hour after the ultrasound was done, my doctor called and said, well, it's nothing really clear, but it still seems that there's a bowel problem. So why don't you just go to the emergency room? And if you need to have surgery immediately, they'll figure it out. So by 7:30 that evening, I was in the emergency room. So right, all in one day. This happened really quickly. I was really fortunate for that. They scheduled me for a CAT scan. I went and did that, and then it's the classic, a couple of hours later, you speak to one doctor and all of a sudden 2, 3, 4 doctors come in and they start asking you about your family history, and they're not revealing too much at first, but you kind of figure out really quickly what's going on.
Cristobal, I'm sorry, but what year was that all started?
Sure. So this was in November of 2019.
Okay, thank you.
And so they admitted me to the hospital. They wanted to do it. So this was the Tuesday. They said they would try to schedule a biopsy for that Wednesday, so within that same day. And that morning is when, so that Wednesday morning is when, I started meeting with the oncologists. They'd coming in and asking questions, asking about my family history. They didn't. They knew about my mom's mesothelioma, but because this was in my abdomen, not in my lungs, they thought that's not likely the case. And it turns out, I didn't realize until later that it was, they thought, really, really serious, because once you start getting an abdominal cancer, that's usually not a primary site of cancer. So it's, very worrisome. So they did MRIs on my brain. They were, the first time I saw the doctor smile, it was when they said, no, your brain is clean. You've got nothing, there's no metastasis there. They did the biopsy, and I think by Thursday or Friday, I was released from the hospital, went home and waited a week for the biopsy results. So for them, it was clear that I had, the initial diagnosis was a peritoneal carcinomatosis, which is just a cancer in the abdomen. And then the Thursday, so a week after I was in the hospital, I got a call from the oncologist, who was, really sorry. He said, because it turned out to be peritoneal mesothelioma. And as any meso patient will tell you, I think when you first talk to doctors, it's not good news. Immediately, obviously, I kind of remembered my mom's struggle. And it was a first, grim first few minutes. But my doctors, it was a great team. They made an immediate appointment for me the following day, the Friday, with a surgical oncologist who brought me in, and who was one of the people who was performing HIPEC surgeries at UCLA, which was where I was being treated. And we scheduled cytoreductive surgery and HIPEC for late December, just before the Christmas break, 2019. And, we knew that the odds were tough. I think at the time they said something like, the 5-year survival rate is about a little more than 50%, but that beat the 5% for not qualifying for the surgery. So I was really fortunate to qualify for the surgery. I went in on the 19th of December for my HIPEC CRS. My recovery was a little slower than expected. I had some issues. They did I think it's called an omentectomy. They removed my omentum, my gallbladder, my spleen, my appendix, did a lot of cleaning in there, and then did the HIPEC. And then I was finally released from hospital. Again, the recovery was slow because I ended up getting septicemia. So I was on, was in and out of the hospital in February and March, which is just when COVID started happening. So that experience was interesting, I guess would be the word. But the staff, all the staff and the nurses were fantastic, took really good care of me. And finally, we cleared all of that up by May of 2020. And then that's when I went in for the 6 rounds of adjuvant chemotherapy with initially cisplatin, pemetrexed, and Avastin. Eventually, the cisplatin was a little too toxic for me, so we switched over to carboplatin, and I finished that in October of 2020. That's right. And so I've not received any treatment since then. I go for follow-up CT scans and PET scans quarterly, and those have remained clean since then. So I'm super happy. So I'm a little over 3 years out, 3.5 years out from the initial diagnosis. So that's fantastic. On the other hand, a little complicating feature is that about a year afterwards, we started noticing, just a very slight marks on the chest portion of the CT. It's really ambiguous. Couldn't really tell what it was. And so I've spoken with doctors across the country, thanks to the Meso Foundation. I was put in touch with various teams. And I finally ended up at NIH, where we did follow-up scans and video-assisted thoracoscopy, VATS, and they discovered that I actually, in fact, have meso on the left and the right side, so both lungs, as they call it. It's a tri-compartmental, I guess. Each lung is a separate compartment, and then in the abdomen. And so we have been tracking that. It's the technical term, I guess, is it's subclinical, which is to say that it doesn't present with any symptoms yet. So it's still relatively early as far as meso is concerned. And so we're tracking. And right now I'm kind of reaching a decision point about what the next step should be. There are obviously surgical options, chemo options, immunotherapy options, and then also the just watch and surveil options. And so that's where we are right now.
Thank you. And Cristobal, how old are you? Just because you are sort of one of our younger patients that we encounter with this.
Sure. So I had just turned 50 when I was diagnosed, and so now I'm 53, almost 54.
And I know your diagnosis is also a little bit complicated because your mom did have mesothelioma. You did do a genetic workup for everything, and they did find that you do carry one of the mutations. If you could talk about that a little bit.
Sure. So going back to my mom, I mean, her diagnosis, it was complicated as well. And one of the complications was the doctors actually didn't believe that she had meso. Because the pathology said clearly it is meso, but it didn't make sense for a woman in her mid to late 40s, with no clear long-term asbestos exposure. It just made no sense for her to have meso. But it was, and certainly at that time no one knew the genetic components of mesothelioma. So when I was diagnosed in 2019, it was standard at that point, especially in meso centers, to do the genetic testing. And that's where they discovered that I had the BAP1 mutation. So for myself, I won't speak about exposures, but it's the same thing. It wasn't clear why I would develop mesothelioma. Or certainly why I would develop it, a little over 20 years after my mom. But there it was. So I do have the BAP1 mutation.
And do you have, I'm sorry that I don't know this answer, but do you have siblings, and have they been tested?
Yes, I have three siblings. They've been tested. I don't want to get too much details because it's their
Sure,
information.
absolutely.
But let's just say that in my family, there are, some of us do and some of us don't have the mutation.
Yes. Okay. And then you also do have children yourself, correct?
I do have two teenage children, yes.
Okay, great. And so now, I know you talked a little bit about that you're kind of on a journey now with NIH, trying to decide sort of where you will go from here. And I know you are also meeting with another team to sort of talk about some options that might be out there for you. But you are looking ahead as to the possibility of maybe doing some systemic therapy or potentially another surgery. As far as your abdominal surgery goes, sort of lasting impressions, do you deal with anything on a day-to-day basis, or do you feel pretty good? I know you still work
Yep.
and lead a pretty healthy and active life.
Yes. So yeah, no, I feel incredibly fortunate for my kind of recovery over the long term. It wasn't easy when I was going through it. That's for
Right.
sure. So yeah, well, so I would say the longer term effects from the surgery itself is that I lost my gallbladder, which just means I have to be a little careful about what I eat. Fatty foods kind of don't make me feel great. But so it's all good things, I suppose, in the long term for your general health. So I try to avoid that, try not to eat too much, try not to eat too quickly, um, things like that. And then I would say the other big effect of the surgery is just especially because I had septicemia, I had to have several drains to drain abscesses, right? And so more than anything, that's the long-term effect, is the scarring inside. So I wouldn't say it doesn't hurt, but it's not super comfortable. I can feel the scarring if I move in certain directions. I don't get a sharp pain, but I get a discomfort, I would say. Ongoing as part of the NIH, they do, alongside the VATS, we also do laparoscopies, just to make sure everything's going okay. And the last one I had was in June of 2020, so just under a year ago. And there's some adhesions there, which is kind of where the scarring, I guess you probably can explain it better, but with the tissues of organs and muscle and fat inside the body kind of stick together because of scarring. So that is a little bit uncomfortable. And then I would say the only other real effect I feel is not from the surgery itself, but from chemotherapy. I think the cisplatin was, as I said, quite toxic for me. So I lost some high frequency registers in my hearing. So part of the good thing there is that we did a baseline hearing test before I started chemo and then tracked it. I have pretty bad tinnitus or tinnitus, so that ringing in my ears, that's super annoying. And then some ongoing kind of joint pain. I got neuropathy in my hands that seems to have recovered. So we're not exactly sure what it just could be aging as well, but that I feel, and I do physical therapy for my hands.
Great. And are you still followed by a team close to home? Because you still do live out in California, correct?
Yes, so I have my oncology team here, my oncologist here, and if I need to talk with my abdominal surgeon, I do. And so, yeah, we speak quite regularly. I actually just went to see my oncologist last week, I believe, and are keeping in good communication, especially between the NIH and my local team, which I think is it's not only helpful, but it's just really reassuring also to know that everyone's on the same team. And that we can coordinate care. I think that's one of the things I do appreciate with the NIH is that they, they're on the East Coast, they're in Maryland. They give me great care when I go out there, but are also really good at coordinating with the local team. So, if I'm going to go for a more systemic treatment, I don't have to be there. I can be at home, which I think is really important for me.
Yeah, very important that everybody works together so closely and sort of flawlessly. So that's great. Um, If you were to talk to somebody who was newly diagnosed, what would be something that you would tell them should be like their first step?
So the very first step, and maybe someone, they went to YouTube and they looked up the video and they're seeing this right now. So I think if they're doing the right thing already, if that's your case, which is reaching out to the Meso Foundation is incredible. I think that there's a community of patients, caregivers, family, which is amazing. And there's the body of knowledge that we have there is great. And I learned a lot from there. Then there's yourself, who is amazing. We can, we call you up or email and sort of you're sort of a wonderful resource that we can hear and bounce ideas off. And I think before you started, I'd spoken to Mary Hersdorfer, who told me you need to, you can talk with people at NIH. Here are the people you contact. Here are the people in New York. Here are the people in Chicago or wherever, right? You can get kind of local thing. And so that recommendation was to get second opinions, and not just second opinions, but expert opinions. That means people who dedicate their lives not just to cancer, but to mesothelioma, because it's such a rare cancer, because the knowledge is so specific. It's always heartbreaking to speak with people who are newly diagnosed, because everybody, it's hard to resist the urge to Google. And when you Google this disease, there's nothing good practically there unless you come across the Meso Foundation. I mean, just in terms of the information that's provided, it's really, really rough. But as we talk amongst patients, where often if you're a non-specialist, we've all heard this news, you get the news and then go home, put your affairs in order. Typically you can expect less than a year. But as patients and mid to longer term patients will tell you, meso is becoming a chronic, manageable chronic condition. So we're still not in a place where we can talk about being cured, but we can talk about, I feel like I have a really fulfilling personal and professional life 3.5 years out. And that to me is amazing, right? So
Wonderful.
Being in touch with experts and being in touch with the foundation, I think, are the two biggest pieces of advice I can give.
Absolutely. Yes. And I also think you had mentioned, talking to patients that also have the disease is so important because you do face different challenges than other cancers out there. So absolutely.
Yeah. And it's great. We talk, you learn about like things like what happens when you lose your gallbladder. And so, things where you don't necessarily know going in that eating certain foods are, feeling bad after eating certain foods are a consequence of the surgery. Among patients, we talk about this, like, yes, I had to change my diet in this way. I think that for me, after my diagnosis, my HIPEC was so quickly, it went so quickly, I hadn't yet talked to patients about it. And so I did not understand immediately the importance of walking after the surgery, and everyone's tired after the surgery, feel cranky. So I walked a little bit, but not as much as I should have in retrospect. And so I think that was part of the complication of recovery. But now, I hear every time someone asks, what do I need to expect out of surgery? The number one thing we say is walk, 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 walk. And that's so important. And any follow-up, like the VATS procedures I've had, I make a conscious effort to walk.
Yeah.
The other thing I remember, and I was kind of, I suppose, fortunate in terms of this. I think that one of the questions I learned to ask, so I got in touch with other friends I have who've had cancer. I've been in touch with friends I have who are oncologists, not meso-oncologists, but who are physicians. And the question I said is, what do you wish you knew going in when you were first diagnosed? Or what do you wish your patients asked you? And that, I think, is a really helpful question, because then you hear like, oh, I wish I knew right on, if I wasn't happy with my oncologist, I could change. And it's really important to find someone you're comfortable with. Or, again, I always say, I wish I knew I should have walked more. That I think is a really powerful question to ask, and I would recommend that.
Absolutely. As far as traveling goes, because a lot of people get a little fearful about traveling for seeing other doctors, and in your case, you're going, clear across to the East Coast. What has that been like for you? Have there been support services that you've tapped into for that? Any sort of support issues or help that you have found? I know NIH kind of has a program. If they can help, they will help.
Yeah, so NIH is fantastic. Especially if you're part of a protocol there. So I'm part of the BAP1 study. They will help defray the expenses of travel. That's both they'll pay for airfare out there, and then defray part of the cost of housing. So there are hotels in Bethesda, right near, and those hotels have shuttle to go to NIH. The great thing about NIH is there's no, they take care of the cost of all the procedures, everything. So you don't have to worry about paying. You don't have to worry about copays. You don't have to worry about insurance. They take care of all of that. So we don't have to worry about that. I'm fortunate that I have my job. I've been able to keep my job, so I can, I can't afford to go out there, every month, but I've been able to pay for it. I know MARF has a program for patients who are unable to afford travel necessarily, and so they can apply for funds for traveling. I think that's hugely important. So I would say that. Otherwise, I've been okay traveling. I think, a lot of it was during COVID, and it's still ongoing. I'm one of the very few people on an airplane or an airport who still wear masks, but that's fine. When I was a little weaker early on in recovery, I would take advantage of the extra time for boarding, and that was good. But other than that, it's been okay. Again, one of the things I heard early on in some of the patient meetings, and this is really important, it's your life and you get one of them. So, you need to, I think it's important to do the things that are important for you, to advocate for yourself, and to say, I don't like traveling. I don't want to go by myself to Chicago or to Bethesda, but I really need to do this. And so, that's what was important to me. And because I have kids, it was more difficult to bring, for example, my partner with me, or to bring them with me. So I just go on my own, and that'd be fine.
Yeah. No, great. Thank you so much. I so appreciate you doing this for us. I think that this will help other patients that are newly diagnosed, or even, going through their diagnosis and maybe having a reoccurrence, or, needing to look for another opinion. So I thank you so much for this. You've been great for our foundation. We appreciate you so much. So thank you.
Well, thank you so much. Like I said, I think that MARF has been just amazing. All of you, you've certainly helped me out directly, sort of to bounce ideas off and to get more information, especially as these issues, this cancer is complicated, and these issues are complicated. And sometimes it just helps to talk things through, and sometimes not talk them through with your doctor, or informed with what your doctor tells you, and say, okay, so what can I expect from this kind of surgery? And I know in our last conversation, I asked, what questions should I ask? And you were really helpful in terms of framing some questions regarding surgeries, or multiple surgeries, and things like that. And, I think when someone is diagnosed with cancer, one of the first questions that comes to mind is, how much time do I have? And that to me is not, I suppose on one level I'm curious about that, but that's not the relevant information for me. It's more like, all right, so how do I live the life that I want to live, that I've made for myself, and how do I live through that life with this diagnosis, and talking to people? And so that's been super helpful to shape my decisions, and well, not just mine, but our family's decisions. So
right, absolutely. Oh, yeah, no, I appreciate that. And I'm definitely a better person for knowing you and for hearing your story and being a part of your journey. So I thank you so much. And thank you for being here today.
Oh, it was my pleasure. Thank you so much. I appreciate it.